the U.S.-Mexico border. You're talking about 600 miles of border fencing and walls that currently exist being expanded to more than 1,400 miles of the 2,000-mile border. You're talking about a Border Patrol force that today is more than 20,000, which is more than double what it was in 2001, being doubled yet again to more than 40,000, and all this for the cost of upwards of $50 billion a year. And as Representative Gallego pointed out, this is at a time of tight budgets, of sequester, of record deficits and debt. We simply can't afford to move forward like this. But I will grant the proponents of these measures this. There's a certain crude logic to that. If you have a problem with immigration, if you have a problem with flows northward from Mexico and Latin America, then putting a wall in place, doubling the Border Patrol that's patrolling that line, there's a crude logic to it. And it's a solution, albeit a 19th century solution, as our Senator said, to a problem. But it is a problem that, by all accounts, does not exist. Net migration from Mexico last year was zero. We had record southbound deportations, record low northbound apprehensions. We're spending $18 what we were spending in 2006. As I mentioned before, we've more than doubled the size of the Border Patrol, and the border is as secure as it has ever of Congress to care about the border necessarily. But you're doing harm to the national economy. So if we need to spend more money, if we need to put tighter focus on the border, this is where we need it. And instead of more Border Patrol agents, and those that we have are doing a remarkable job, and we want to make sure that we support them objectives and that we can fair road, which, by the way, under the sequester we're not doing today. Instead of taxing resources where we already have it covered, let's move those resources to our ports of entry and make sure that we have Customs and Border Protection officers who can speed the flow of legitimate travel, trade, and commerce through our ports of entry. That will create jobs not just for my district. That will improve the quality of life not just in El Paso and along the border, but it will be a net benefit to this country. It will be an investment that pays back many, many, many times over. And now to hear from somebody who also understands the U.S.-Mexico border quite well, who lives there, who has his family there, has grown up there, and has done a remarkable job representing the U.S. border. I'd like to introduce and yield to Philemon Vela from Brownsville, Texas, which he may consume.
Mr. Today, I rise which condition this construction of barriers 1997, President Reagan stood at the Brandenburg Gate near Berlin Wall and said, "Mr. President, tear down this wall." Certainty, the border fence, and migration, and increased border security for many reasons. Which are many who live on the U.S. family and friends, versa. The border fence has fragile wildlife on both sides. Additional and lack of opportunity. Since 2006, approximately 71,500 people have been killed as a result of cartel violence in Mexico. While Mexico's overall economy has performed exceedingly well in the recent past, economic conditions along the U.S.-Mexico border remain consistently stagnant. The real solution for reducing the flow of undocumented immigrants into this country from Mexico is to promote economic development on both sides of the border, thereby providing more economic opportunities for an ever-increasing population. Fostering a vibrant border economy will mean that young men and women will have an option other than organized crime to provide for their families. While this amendment ignores the fundamental cause of illegal immigration into the United States, it also does not account for the deep trade ties between the United States and Mexico. As my colleague from Texas mentioned, last year alone, the United States greatly benefited from the estimated $500 billion in trade, with Mexico supporting 6 million jobs across the United States. Trade with Mexico even impacted the economy of Alaska and our island state of Hawaii. Importantly, trade with Mexico is critical to the economies of states on the border and those far removed from the Mexican border. I give a few examples. In the state of New Hampshire, for instance, the total trade volume between the state of New Hampshire and the country of Mexico is $1.5 billion. Computers and other electronic products amount for $680 million, or 72% of New Hampshire's total exports to Mexico. 28,531 jobs in the state of New Hampshire depend on trade with Mexico. In the state of New York, the total volume of trade between the United States and between the country of Mexico and the state of New York is $5.67 billion. New York exports $2.6 billion worth of goods to Mexico. 381,238 jobs in New York rely on trade with Mexico. Mexico ranks among New York's 10 international markets with 384,000 travelers per year. Jewelry is one of the largest exports from New York to Mexico, with $500 million in value. In the state of Pennsylvania, the total volume of trade between the state of Pennsylvania and the country of Mexico is $5.59 billion. 246,409 jobs in Pennsylvania rely on trade with Mexico. Primary metal manufacturers are Pennsylvania's top sector in exports to Mexico, representing $560 million and 21% of the state's total exports to Mexico. In addition, $547 million in primary chemicals are exported to Mexico. In the South, the state of Tennessee, the total trade volume between the state of Tennessee and the country of Mexico is $7.62 billion. Tennessee exports $3.81 billion to Mexico. 23% of all cotton exported to Mexico from the U.S. comes from Tennessee, making the state the second largest exporter of cotton to Mexico with $256 million in revenue. $855 million worth of transportation equipment is exported to Mexico from the state of Tennessee. 122,085 jobs in Tennessee depend on trade with Mexico. In the state of Alabama, the total volume of trade between the state of Alabama and the country of Mexico is $2.7 billion. Alabama exports $1.72 billion worth of goods to Mexico. Transportation equipment is the state's largest export industry to Mexico, generating $466 million and representing 27% of the state's exports to Mexico. 86,212 jobs in the state of Alabama depend on trade with Mexico. The state of Kansas. The total trade volume between the state of Kansas and the country of Mexico is $2.38 billion. The state of Kansas exports $1.63 billion in products to Mexico. Crop production is Kansas's strongest industry in terms of exports to Mexico, accounting for $588 million in export revenue annually and 37% of total exports to Mexico. 11% of aerospace products exported from Kansas go to Mexico, and Mexico is the largest importer of corn and third largest importer of beef from the state of Kansas. 59,341 jobs in Kansas depend on trade with Mexico. Clearly, all states benefit greatly from trade with Mexico. Erecting more border fence would shield the robust economic relationship that our country and our states enjoy with that country. Rather than constructing new hurdles to trade with Mexico, we should be tearing down trade barriers in order to promote and strengthen our relationship with our neighbor country. Thank you, Mr. Speaker. I yield the rest of my time to Mr. O'Rourke.
I want to thank my colleague from the Rio Grande Valley. Here he is meeting the anxiety, the paranoia, the legislation based on emotion instead of facts with the cold, hard truth of our economic interdependence with Mexico. We ignore this at our peril and to the peril of millions of jobs in this country, hundreds of billions of dollars of economic opportunity and growth. We welcome the focus and the attention at the U.S.-Mexico border, but we want those who are watching to see the truth. And the truth is we are a positive, dynamic source of jobs and economic opportunity for this hemisphere, for both Mexico, and most importantly for us in this body here in the United States. It is my feeling that the wall that exists today, the 600 miles of the 2,000 miles that join the United States and Mexico, the 600 miles of fencing today will soon be looked at by a majority of Americans in this country as something to be ashamed of, as folly that followed the paranoia and the anxiety that we have towards Mexico and the U.S.-Mexico border today. When you think about the cost of this wall, the current wall cost us more than $2.4 billion to build and will cost us another $6.5 billion to maintain for just the next 20 years. Why would we then spend more than $16 million per mile for additional walls that will cost us billions of dollars to build over the next 5 or 10 years, and then probably hundreds of millions, if not billions, to remove once we've realized our mistake, which I hope is not too far in the future. And if there is fear and anxiety and frustration with Mexico, I'd like to know where that's coming from, because it's not coming from the facts and the figures that we see in El Paso and that we see when we look at Mexico. Mexico is a growing, dynamic, vibrant economy. It has millions of people moving into the middle class. It's modernizing. It's breaking up its monopolies. The country of Mexico has more free trade agreements with other countries than any other country on the planet. This is a country that wants to move ahead, that wants to do well for its citizens, that's investing back in itself and is providing opportunity so that people don't seek that opportunity in other countries like the United States. I think that helps explain why net migration from Mexico into the U.S. was at 0 this past year. Again, Mexico is not a threat. The U.S.-Mexico border should not be a source of anxiety. Mexico is a big part of our future. It's been a big part of our past. And it's a positive source for those things that we want to see happen in this country. And someone who understands that quite well from representing her district along the U.S.-Mexico border in Southern California, part of a state, by the way, that has seen more than a 30% drop in crime over the last 10 years, despite and maybe because of the fact that it borders Mexico and has such large immigrant populations. I'm happy now to yield the floor to my colleague Susan Davis from California.
Thank you very much. And Mr. Speaker, I'm very pleased to be here with my colleagues today, and I certainly want to thank Mr. O'Rourke and Mr. Vela and Mr. Gallegos for presenting what we all believe is so critical and so important. It's not just about border communities and border cities that acknowledge and benefit from our relationship with the border, and particularly with the Mexican border. It really is the entire states that we're representing and far beyond that. Because my colleague represented how much trade is done in other states throughout our country. We know it's important to national security. We also know it's important to our economic interests, because that trade fuels our economy, it stimulates our competitiveness, and it also reflects our cultural values. Those things are critically important, and we need to bring those in to the discussion as well. You know, we often talk here in Congress about the need to give businesses the certainty that they need. But honestly, look at what's been happening today. The budget standoffs and sequestration are doing just the opposite of what our businesses really need. And in fact, Congress's inability to pass legislation is jeopardizing our greatest opportunity right now, which is economic growth, and that is our commerce along our borders. 6 million U.S. jobs depend on trade with Mexico. Should I say that again? 6 million U.S. jobs depend on trade with Mexico. Last year, imports from Mexico accounted for over half of our two nations' total trade, which is about $278 billion. Sometimes we can differ slightly on those numbers, but that's about what it is. That trade relies on modern infrastructure, it relies on roads, and it relies on ports of entry that can accommodate the enormous volume of goods coming through every single day. But what's the reality today? Well, the reality is that our ports of entry are in various states of disarray because of underfunding for improvement and modernization projects. Our ports do not have the capacity to meet this demand, meaning that often people have to wait up to at least 2.5 hours during the day of commerce, and trucks up to 6. You know, there's an app out there that tells users how long of a wait to expect. And in San Diego, in the district, wait times today on Sunday at the San Ysidro Port of Entry can reach 3 to 4 hours, and now and then it can even exceed that. The other day I was up early getting ready to board a plane to come into Washington from San Diego, and even at about 5:30 in the morning at the ports of entry, the wait was about 1 hour and 45 minutes. And you know what? They were celebrating the fact that it was only that long. You have to come down to the border to see this. I think for folks who don't live on a border, like we have in San Ysidro and San Diego, you can't even imagine how many cars are assembling there. It's pretty spectacular. And you know what? It shouldn't be this way, and it doesn't have to be this way. No modern economy can operate under those conditions. No modern economy devotes just $50 million to fund infrastructure projects for ports of entry for our entire nation. Think about that. $50 million for all of our ports of entry. What we should be doing is viewing our ports of entry and our borders as assets to our nation. But instead, chronic underfunding has led to wait times that cost our country every day in total productivity, loss, and tax revenue. It's tremendous. Wait times translate to $7.2 billion in output loss and cost us upwards of 62,000 jobs. 62,000 jobs. People who could be working if we could make our ports of entry more efficient. Well, we do have some good news. Congress has already authorized infrastructure improvements at the nation's port of entry, including critical phases at the San Ysidro Port of Entry in San Diego. We know that's the busiest land crossing in the world. So that's the good news, that Congress has authorized that. What's the bad news? The bad news is that Congress has refused to provide the funding necessary to break ground on those 2 additional phases. And you know what? That's just not consistent for what we talk about as needing a border security bill for this nation. The fact that that is so underfunded and chaotic by any means suggests that, you know, we don't really think that we need to do the right thing when it comes to border security. So let's place the need where it belongs. It belongs on infrastructure, and it belongs in trying to figure out what is it that's going to make a difference for this country. Well, certainly funding that border security will help on the border for ports of entry. If there is one thing that this body should be able to do, that we should be able to come together on, it should be a smart investment that businesses want and workers need. I can assure you that's what they want and businesses need. So I urge my colleagues to get to work on a budget that supports our nation ports and our engines of economic growth and place the need for border security where it belongs, and we know that it will help and create the economic engines that we need for our future. Thank you so much to my colleagues, and I appreciate your bringing us together for this. Thank you.
Thank you. Thank you, Representative Davis, and I appreciate hearing, again, more facts, more rational arguments from my colleague from California about the border. And I place that in contrast to, again, the anxiety and the fear that is surrounding much of the border policy that we're hearing from the Senate and in some circles here in the House. And the reason that we are so sensitive to that here on the U.S. side of the U.S.-Mexico border is we bear the brunt of those policies. The disproportionate burden of the enforcement of the cost to our economies, to our way of life, falls to those communities that reside on the U.S. side of the U.S.-Mexico border. But what is the source of that anxiety and fear? Where does it come from? And if I had to characterize it bluntly, I'd say that it comes from those who feel that Mexican nationals are coming to our country to steal our jobs, take our resources, consume our benefits, and put our country at an economic disadvantage. But again, if we take that and then actually look at the underlying facts, we see a far different picture. The Congressional Budget Office has recently scored the comprehensive immigration reform proposal from the Senate and has found that over the next 10 years, it will net $197 billion in deficit reduction for the United States. That's a huge positive for this country, and that's by the numbers, by a nonpartisan analysis of the facts. The next 10 years following that first decade, it jumps to almost $700 billion in deficit reduction. Those are net positives to this country. And even for those immigrants who are here today in an undocumented status, we find that they are net contributors to our economy and to our tax system rather than net beneficiaries in terms of drawing down those benefits and resources. So any way you look at it, any way you cut it, immigration to the United States is positive. And again, the factors that we see today in Mexico lead us to believe that the situation will only get better. Mexico is the 14th largest economy in the world by GDP. It's expected to grow from this year to 2016 by almost 5% annually. The lowest unemployment rate in all of Latin America is in Mexico today, and we expect it to fall as low as 3.5% by 2016. If we have net zero migration from Mexico today, I think there's a good case to be made that it will be a negative number by 2016. There is absolutely no sense in building 1,000 miles more of walls, of spending $50 billion in doubling the size of the Border Patrol for a threat that does not exist, for a problem that does not exist. I think we've illustrated where those resources would be better spent to create more jobs, more economic growth, and more positive development for the U.S. economy and for our country. Someone who I think has been quite articulate on this issue in the past, especially from his perspective on the U.S.-Mexico border in Arizona, is Representative Raul Grijalva, and I now yield such time as he may consume so he can further illustrate the positive dynamic of the U.S.-Mexico border.
Thank you, and thank you, Mr. Chairman, and let me thank our colleague from Texas, Congressman O'Rourke, for organizing this discussion. A discussion that needs to happen. A discussion that talks about the border in a full context is drowned out by the shrillness, the overreaction, and a rhetoric that sometimes borders or crosses into hatred and fear. I represent District 3 in southern Arizona. 300 miles of border between U.S. and Mexico that I happen to have the privilege to represent. Border communities such as Nogales, San Luis, Sázabe are all part of this district that I represent. And I grew up in those borderlands that share a common history, heritage, and share a common dependency on the economic development and the jobs and the social welfare of those borderlands. That dependency is with our neighbors across the border in Mexico. I want to talk a little bit about looking at this context in very human terms, in geographical terms, and in historic terms. The discussion on immigration reform when it comes to the issue of security has been about how much more can we do in order to satisfy, in order to accommodate, and in order to draw more support for a comprehensive immigration reform package. I understand the logic, but I certainly with the Corker Amendment don't understand at all the overkill and the excess. To double the number of Border Patrol agents without a strategic plan, without accountability for what's been, for the 19 billion that have been spent on this border up to this point, I think is throwing money, potentially good money after bad. Second of all, to look at technology as the answer, we should also be looking at addressing our ports of entry, addressing the very real need of understaffing among customs agents that are essential both to security and the flow of goods and services, trade, and economic development. My colleagues have indicated how many jobs depend on this trade. This is the second leading trading partner in the world for the United States, Mexico is. And we cannot have a border whose sole purpose is to shut down the availability of goods and services and to cripple and constrain the very trade that we need for economic development in this country. Many jobs depend on it, and certainly the health and well-being of the region depends on it. The excess of security based on the amendment to the legislation in the Senate, the overkill, as I called it, I think one has to hearken back to discussions that have been before this floor in the past, and that has to do with how much is enough. I will take a very, very safe bet that regardless of how much, how many, and how much money is spent on security along that border, how high the fence is, how long the fence is, that there will still be those who get up on this floor and in the other chamber's floor and demand more, without a plan, without accountability, and without an audit for what's been done at this point. Let me discuss the current state of security on the border. Largest numbers of deportations, the largest number of detentions, 20,000 Border Patrol agents on the border, largest number of apprehensions, and a reduction in unauthorized entries into this country, significant reduction. So the plan in place to deter is, like it or not, working. And for us to layer that with additional money, additional personnel, is, I think, to me, pure political symbolism and doesn't really address the issue of security. If you want to address the issue of security, you must deal with the ports of entry primary, you must fully staff customs, and you must have the very necessary blend on the border of security, trade, economic development, and necessary and important exchange with Mexico. Two issues. The humanitarian issue in Arizona. Arizona has been ground zero on the question of immigration and immigrants, beginning with the state law 1070, which was thrown out by the Supreme Court, beginning with various legislative efforts at the state level to make immigrants a target in that state that have been, many of them, successfully defeated in the courts. But also the flow of drugs should be the point of concentration. The organized crime on both sides of the border, gun running there, drugs coming this way, people smuggling, the abuses associated with that. If there's going to be a security initiative as part of this new comprehensive immigration reform, let's be focused, let's be real, and let's address the real problem and the humanitarian crisis. Over 6,000 souls have perished in the desert in southern Arizona, in my district, and on the Otham Reservation. People desperate, people being left there by coyotes. It's a humanitarian crisis, and if the money we're talking about in enforcement does not include rescue, humanitarian relief, then it's money that's not addressing the problem. I guarantee you that over a 10-year period, if 6,000 people had perished in any other part of this world, we would be calling it a human rights and a humanitarian crisis. It doesn't get the attention it should, but the tragedy continues. And with this increased security, people will look for further and further more desolate areas in which to attempt or to be dropped off by smugglers. And again, the deaths will increase. I suggest that that has to be part of it. Oversight in the context of security needs to be part of it. Human rights abuses along the border due to the increased militarization has to be part of it. A uniform policy for the use of lethal force has to be part of it. The GAO report on those very procedures I just mentioned has to be completed, and those recommendations that need to be implemented before we continue to talk about giving more money without taking care of the civil rights, due process, and humanitarian crisis that we have on the border. We have an opportunity in this Congress to finally reform this broken system of immigration. We have an opportunity to do it in a just, humane, fair, and secure way. And as we go forward with the debate in this House, Let us hope that the discussion is over facts, that it's rational, that we talk about the human quotient involved in this discussion, and that the pandering, fear-mongering, and divisions that have marked this debate in this House, that the leadership of this House instructs their members that this is a debate about the future of this country, not the divisions in this country. I want to take time again to thank Mr. O'Rourke, Congressman O'Rourke, a freshman who has taken a leadership in this issue and in the borderlands, and very grateful for organizing this, and I yield back.
I want to thank my colleague from Arizona for talking about the moral dimension of this issue and putting a human face on a problem that, and also the opportunity, the other side of that problem being the opportunity that we see along the U.S.-Mexico border. And to add a little bit to what he said, if you just look at the numbers in terms of northbound apprehensions along our southern border, 7 years ago, the average agent apprehended 106 migrants. 106 migrants for every agent patrolling the line. Last year, it was 17. In the El Paso sector, it was 3.5. The Corker-Hoven proposal to add more than 800 miles of additional border fencing to the tune of billions of dollars, to double the size of the Border Patrol to the tune of more than $40 billion, is a solution in search of a problem. But not only that, not only is it a waste of taxpayer money, it is also going to cause harm and death along the border. Last year, 477 people, human beings, died last year trying to cross the southern border. It's the second highest number on record despite historically low migration. So as we build these walls and fortify our border, we push people who are coming here for economic reasons further out into more treacherous, harmful, and deadly terrain, and they're dying. More than 5,000 people have died in this manner over the last 15 years. Today, someone is 8 times more likely to die crossing than they were 10 years ago. So whether you look at this issue from a moral perspective, what we're doing and proposing in the Corker-Hoven Amendment to Comprehensive Immigration Reform is wrong. Whether you're looking at it from an economic perspective, where we have record job growth and creation related to our trade and commerce with Mexico, shutting that down and not applying resources to facilitating that trade is wrong. And when you look at it in terms of good policy and being good stewards of taxpayer money in a time of sequester, in a time of deficits and record debt, this proposal is wrong. I do want to say that comprehensive immigration reform is a good thing, and we want to see it move forward. But let's not attach proposals like this one to it that will do far more harm than good and may imperil its chances of success in this House and for this country going forward. Before I close, I do want to yield to my colleague from the Rio Grande Valley, Filemon Vela, who wants to make sure that we are focusing on problems where they truly exist, not where they have been created for political purposes. And with that, I yield such time as he may consume to Mr. Vela.
Mr. Speaker, thank you. Thank you, Mr. O'Rourke. I just have one final point to make, and that is that in neither chamber, and for that matter in neither party, do we hear talk these days of two things that I think are very crucial to the debate, and that is the violence in Mexico. Both countries have an obligation to ensure that we eliminate that violence. Secondly, economic development along the U.S.-Mexico border. The Mexican economy is doing exceedingly well in central Mexico, but along our U.S.-Mexico border, we still have a lot to go. And until we address those two things, the violence and the economic conditions along the border, we're going to have a very difficult time solving this entire problem. Thank you. I yield.
I thank my colleague from Texas, and Mr. Speaker, I'll conclude by saying that I hope that what we have discussed today has been able to illustrate the positive dynamic of the U.S.-Mexico border. What we have offered historically to this country, whether it is as the Ellis Island for much of Latin America, or the economic growth that we've seen not just along the border and in border states, but for this entire country. 6 million jobs depend on the commerce and trade that crosses our ports of entry along the U.S.-Mexico border today. I hope we've also been able to illustrate how harmful policies don't just hurt the U.S.-Mexico border, they hurt the rest of this country and our ability to grow this economy and create more jobs. And lastly, Mr. Speaker, I hope that we've been able to show a positive way forward where we can have comprehensive immigration reform, we can respond to concerns about a secure border, but we do so in a way that does not sacrifice our economy, our way of life, and our Constitution. And with that, Mr. Speaker, I yield back.
Jimmy yields back. Under the Speaker's announced policy of January 3, 2013, the Chair recognizes the gentleman from Connecticut, Mr. Larson, for 30 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I seek unanimous consent to revise and extend my remarks and introduce the extraneous materials as it relates to this special order.
Without objection, so ordered.
Thank you, Mr. Speaker, and I believe I'll be joined by my colleague from Ohio, Mr. Ryan, who I will recognize at the appropriate time. But we wanted to make this special order this evening about solution-driven legislation and the need on behalf of the United States Congress to come together in a nonpartisan manner and get after the concerns that this nation cares so deeply about, most notably those as they relate to jobs and security and the well-being of the country. This evening, Mr. Speaker, well, what if I told you that we could deal with all the rising costs of health care, bring down the national debt, and do so while providing better quality, coordinated, patient-centered care? There might be some skepticism. But what if I further told you that we could do it without raising taxes or cutting Medicare? In fact, what if we did it by extending the benefits of Medicare? What if I were to tell you, Mr. Speaker, that this idea germinated with the Heritage Foundation, a conservative organization dedicated to conservative ideas, and was piloted by a Republican governor in a Democratic state and served as the basis for what we now call the Affordable Health Care Act. The Affordable Health Care Act, in its final form, was something that a number of colleagues on the Democratic side didn't necessarily prefer. It was not their first choice. A number wanted to see, well, single payer or Medicare for all. But that is not what transpired, and that is not what is the law of the land, nor is what is upheld by the Supreme Court. We need in this body a paradigm shift that will allow us to come together and embrace the ideas that we all agree upon in a way that we can move this nation forward. The budget leader in the Republican conference is Paul Ryan, a distinguished gentleman, bright and capable. We agree that health care costs are what are driving our national debt. There is no doubt about that. Statistics will reveal that. Further, when it comes to improving patient care, patient outcomes, making sure that we provide for our elderly, making sure that we have a continuum of care for people, that's something that's neither Democrat or Republican. That's something that is truly American and that we all agree on. Where we may disagree, but where we can come together, is in recognition of how we get to the solution. Solve this problem instead of these endless, taste great, less filling debates that go on in the United States Congress. To do so, you have to be bolstered by studies. There's no less, and this slide will show, than 10 different studies that have been authored by private sector individuals that all point to one thing. There's $750 to $800 billion. Let me repeat that. $750 to $800 billion annually that's wasted in fraud, abuse, and inefficiencies. This evening, we want to focus on the inefficiencies, noting, of course, that fraud and abuse and waste are very important, been documented several times on 60 Minutes and other notable sources as well, and certainly is something that will help us in terms of bringing down the costs of health care, which, of course, solve our problems with the national debt. Health care costs in the United States of America have risen to 18% of our gross domestic product. This next slide will demonstrate clearly that we are way above every other Western democracy. And this is what the inefficiencies of a system have produced. A hodgepodge system that is inefficient and driven upwardly in its cost because of the lack of coordinated care and outcomes that suggest a new paradigm shift and people coming together and embracing that which is in the public health care system that works and does extraordinarily well, all that's in the realm of science, technology, and innovation that we get from the National Institute of Health and for the Center for Disease Control, that have been taxpayer funded and produced miraculous opportunities and a better quality of life. And then thirdly, to embrace that with the private sector entrepreneurial efforts to drive inefficiencies out of a system. This chart demonstrates how that can be done, and that there is both the profit in doing it for the private sector and the results of lowering that cost for the public sector, and an outcome for patients that is centered around wellness, their well-being, and their security in the later years of their life. It's that combination that we believe can work. How do we know that that is so? We're fortunate to see, even in this time in politics where there has been disagreement and too much politics around the quality of health care that our citizens rightly deserve, and the private sector, in our hospitals, with our doctors, with our surgeons, with our medical devices, and with our entrepreneurship, are coming to embrace. The passage of the Affordable Health Care Act is, in fact, a paradigm shift. What do we need to shift to? How do we need to move that forward? Mark Bartolini, the president of the Aetna, based in Hartford, Connecticut, has said the one thing we have to make sure is this, that we're not taking away benefits from people who are going to pay for the medical devices, the hospitals, the doctors, the insurance, and the pharmaceuticals that they all need. We need to enhance that system. Economists like Clayton Christensen have talked at length about how we need to be disruptive in economies, and in doing so, disruptive in terms of our innovation. with the genomic projects at hand and the potential for people to be living well beyond the age of 100 for my children, and for current generations, as we all know, obviously living longer, there's a need for us to embrace common sense solutions and not issues that either say, well, we have to drive down the debt at the expense of beneficiaries, or that we have to raise taxes to help the beneficiaries. How about we drive out the inefficiencies within the system, get after the fraud, abuse, and the waste, and work together as Democrats and Republicans and achieve the goals that we were sent here to do by both lowering the national debt and securing the future by making sure that there is Medicare there for all of our recipients. I think of so many people nearing the age of retirement who get trapped in this gap. Once you turn 56, you start thinking, is my company going to keep me to age 65? What is going to happen to my pension? But most importantly, what is the bridge I'm able to take to get to Medicare? And will it be there? There's got to be a resounding yes, and the important thing is that there's a path forward to this. Two things that are important to remember. One, that the national debt is real and that we all agree that it has to be addressed, and the primary driver is health care. And secondly, that Medicare is not an entitlement. It's the insurance that people paid for. It's taken out of your paycheck. And that if we drive the inefficiencies out of the system, we actually can enhance the Medicare system and make it solvent well into the future while paying down our national debt. That should be the focus of the United States Congress. It will help the economy, but most of all, it will help people in terms of the quality of care that they need. This is what we hope to achieve in special orders and prevailing upon our colleagues on both sides of the aisle to come together and discuss solutions that will both reduce the debt and preserve the Medicare system. A person who understands this better than most, who has made first-hand trips to hospitals, who has written books, in fact, or at least a book, that as I seek to credit you beyond your authorship, Mr. Ryan, but certainly someone who understands the importance of coordinating care in such a manner that an enlightened new republic that we are will be able to participate in the wholeness and wellness that can come from this paradigm shift afforded by the Affordable Health Care Act, and where reasonable minds can come together to achieve these goals. I yield to my colleague from Ohio.
I thank the gentleman and would just like to say that a deep thank you, because I think this is one of the key issues that we need to address as a country in order for us to have healthier citizens, have a healthier economy, drive down the national debt. And as you said so eloquently, the big driver for our national debt and deficits is the Medicaid and Medicare program, issues dealing with health. Look at what's weighing down businesses right now. Small businesses especially, huge increases in health care year in and year out, 10, 15, 20, 30%. We've all had people come to our office and say, hey, it went up 90% this year. How am I supposed to plan for capital investments? I want to build a new or buy a new machine, and on and on and on and on. So where we start is that the current health care system is not working. We spend $8,000 per capita in the United States versus $3,000 in developing countries, and we have worse outcomes. We have worse outcomes here. And what we're talking about, what the CEO of Aetna is talking about, is how do we take this system and recognize and begin to appreciate in 2013 in America that if we put some money into prevention, if we pay doctors and nutritionists and dietitians on the front end, we're going to save a boatload of dollars on the back end. 75% of health care costs go to chronic diseases that are mostly preventable. So here we are, bogged down by a system when the answer is patient-centered care and having people participate in their own health care. This is a challenge to every American to take responsibility for their own health, their own well-being, and to create a system that incentivizes everyone who's in the system to operate in this fashion and help drive down health care costs in the long run. And we all know this intuitively, that if you take care of yourself, your diet matters, your nutrition matters, your exercise matters, your checkups matter. And through the Affordable Care Act, by having everybody covered, it begins to change that business model of having the insurance company incentivized to keep and help people get and stay healthy. And I think it's time for us to take the advice of the CEO of Aetna. This isn't John Larson, this isn't me. We're looking at the statistics here in our country, and we've got to say, this is unacceptable. We have so many sick people in our country, and we're doing nothing to prevent them from getting sick in the first place.
And Mr. Ryan, it just isn't the CEO of the Aetna. As I was pointing out earlier, in a number of studies, whether they be done by Reuters, whether they be done by a number of Dr. Blumenthal and a number of groups that have been focused on this issue, they all arrive at the same conclusion. The system is inefficient in its form. And how do you improve that system? We're at a fork in the road here, as Dr. Blumenthal from the Commonwealth Fund points out. Healthcare policy, we either are going to end up in a situation, as the poster points out, where we cut payments, reduce benefits, and restrict eligibility for public programs, or we re-engineer health care and improve the health care costs, improve the outcomes for patients. As Mark Bertolini from the Aetna says, the answer lies not in cutting people's benefits, but improving their care. And this is the juncture that we're at. And it would seem to me that, especially in this body, that we now have an opportunity. We all agree that the national debt is a problem. We know that health care is the primary domestic driver of that debt. We have an opportunity to change that. We have a structure, the framework of which, as I said in my opening remarks, was provided by the Heritage Foundation and was pioneered by Mitt Romney in Massachusetts as a governor, and done successfully. Let's expand on that opportunity, only make it better. Make it better because we know the great virtue of public health and all that it's meant for the wellness of this country. We know the great strength of our hospitals and doctors and our scientific community, our innovators, our manufacturers, our medical devices, our pharmaceutical companies. We know the great genomic project that is going to have remarkable abilities that are going to enhance the quality of life like we've never seen it before. Instead of arguing the old wars and the last battles, we have to be embracing the future in a way that it makes the American citizenry secure in the outcome of knowing that science, technology, and innovation, their government, and the best of the private sector are all working on their side. It's not a question of choosing one or the other. It's embracing all three in a way that both lowers the cost, demonstrated in study after study after study, that will also enhance the quality of health for our individuals. So many people in Ohio, I know, have problems and have dealt with this, and I yield back to the gentleman.
And to figure out how to target the technology, and we were out at Walter Reed a few weeks ago going through and seeing all the various techniques and approaches that are being used for our veterans that are coming back. And they talked about having high-tech health care, high-touch health care. And we have most and a good portion of our health care costs are driven up by the sickest 1% of the people and the top 5% of the people in health care are driving a lot of the cost.
50% of the cost.
From the top 5%. So the top 5% or 5% of the people drive 50% of the health care costs. And I think what a lot of these folks are finding out, that if you can surround that patient, the patient's in the center, and figure out exactly what's going on, and make sure that that patient has preventative care and a consistent doctor and a consistent nurse and a consistent somebody to help to make sure they're taking their medication. These techniques, these medical homes, these accountable care organizations, to surround the patient to make sure that they get better, and then reward the doctor and the nurses and everybody who's at the hospital, everybody who's involved, for saying, we're not going to pay you to the same amount of money every time you see this patient that still has the same problem that they had from the first time they came in. You will be paid to make them healthy. And that begins to shift the incentive and squeeze some of that excess out of the system that the gentleman from Connecticut talked about.
Well, you know, inefficiencies, as I said, was going to be our focus. Let's talk about that just from a practical standpoint. You say the word inefficiency, and what do people actually think? Think about the last time you were in any doctor's office or made any trip to the emergency room and the number of forms you had to fill out. The number of forms where we have complicated a system that needs to be streamlined. One of the things that our colleagues and I should embrace is the need for us to streamline regulation in the process so that it becomes simple, cost-effective, electronically or digitally driven in a way that both reduces costs and adds to a better quality of life for the individual. When Mr. Bertolini speaks, he talks about, as you point out, developing coordinated care with our areas, our centers of expertise. You know, and whether it's the Mayo Clinic, or in Ohio, the Cleveland Clinic, or whether it's Sloan Kettering, whether it's Jackson Labs in the state of Connecticut, by working in conjunction and coordinating the best outcomes, and then also doing this locally from the bottom up, that coordination, quite frankly, hasn't existed before. That's what's driven our health care costs up so dramatically. No other Western democracy in the world, some that have more aging populations than we do, face the similar crisis. We have the opportunity to attack this like no other nation in the world. Just a word about the Genomic Project. You know, Jackson Labs is located in my district in Connecticut. And they're known for their Nobel Prize winners because of what they have been able to do with mice. Mice, as I know the gentleman from Ohio knows, because of their lack of an immune system, allow them to be great vehicles to test with respect to breakthroughs in disease and how we deal with disease. Well, when we add the Genomic Project to that and the advances that we can make in cancer, heart disease, diabetes, all of the areas that plague us, we now have at our disposal, but instead of multitude of tests and random testing, we can now get down to an individual's DNA and make that change. That is enormous cost savings. That is the full embrace of science and technology and innovation. That should be the discussion on the floor here, is the greatest breakthroughs and what we're going to do and how it's American ingenuity, it's American innovation, it's American doctors and surgeons and medical manufacturers and medical devices and chemistry through pharmaceuticals and all the science that we brought to bear. We put a man on the moon in less than 10 years. Can we solve this problem? Of course we can. And it's on the cusp of being resolved. Let's embrace what the private sector is doing. Let's embrace our scientific and university communities and our labs in a way that we're coordinating with them, coordinating in a way that we drive out the inefficiencies because our end goal here is the consumer. It's the patient. It's the citizen of this country who's paid tax dollars for this, who's bought into an insurance system, who believes that his country is going to, or she believes that their country is there for them in their time of need as we make these critical transitions. The American people want to see us here in this body working together. Let's work around the issues that drive us. The national debt, securing Medicare for the future, and understand that we have the tools, many of which we owe to the public health system and the innovation, the labs, the Center for Disease Control, the National Institute of Health, and all that's been done in our universities, as well as the entrepreneurial expertise and the creation and innovation that comes from our great system. Let's enjoin that in a way that we solve problems. Solution-oriented legislation that gets over the ideological divide and recognizes that we need common outcomes on behalf of the American people.
And I think take what is working in areas systemically, but also techniques. Up at Walter Reed, for example, they're using things like acupuncture. They're using things that can help with stress reduction. They're using mindfulness-based stress reduction because we now know in 2013, given all of the brain science, all of the research that the neuroscientists have done all over the country and the world, Dr. Richard Davidson at the University of Wisconsin, and Dr. Amishi Jha at the University of Miami, all of the greatest institutions in the United States, and the scientists that run these labs, that study the body, study the mind, they know that the future of health care is self-care. How do we help people reduce their stress? How do we help some of these soldiers that come back that are on 6, 8,
Absolutely.
10, 12 drugs? We spend $300 billion a year on pharmaceuticals. That's more than many of the other countries in the world combined. And we're not saying that you shouldn't have prescription drugs, because you're going to need them in this system that appreciates and tries to utilize all of the tools in the toolbox to keep people healthy. But how do we create a system where a doctor can have more than 5 minutes with a patient? And it's on to the next one, and on to the next one, and on to the next one. That's not a system. That is not protecting the integrity of the doctor-patient relationship. And that in and of itself can be a healing relationship, being able to sit down with the doctor and find out what's wrong. How much stress and anxiety do people have when they just don't know what's wrong?
The gentleman makes excellent points, and it's a point that underscores that within this system, as the gentleman points out, we are going to need that high quality of care. But our care coordination problems have been driven by flawed designs. The coordination of care in the new era, with all the science, technology, and innovation that we can bring to bear on this problem, and the flawed design of our payment systems are what we need to correct. The beneficiaries will not only be our veterans that return home and are in need of our care, but our general population. In dealing with this, the exchange is going to present a great opportunity. an opportunity to have a paradigm shift, an opportunity for us to come together and solve major problems. And you know what? As the gentleman from Ohio knows, if we solve the national debt problem, then we don't have an issue with sequester, we don't have an issue with debt ceilings, and we can get about the infrastructure system that we desperately need in this country to further enhance jobs. But within the innovation, technology, and manufacture of drugs and of medical devices and the technology that grows out of health care, we have a whole economy that's ready to burst and boom as well. That's what we've got to be about. That's what I believe the American people want to see us solving, and I'm glad that we've taken the time this evening to do that.
Well, if you think about what the small business person who's suffered the brunt of these huge health care increases over the last decade or two, 120-some% increase, I think, in the last 10 years for a small business person, their health care over that period of time has gone up. So if you start reducing that cost, the money that business person will have to reinvest can be a stimulant for the economy. And I yield back to my
I thank
my
the
friend.
gentleman. I see that our time has expired. I thank the Speaker, and we thank everyone for the opportunity to lay out this case of coordinated care and cooperation, reducing our national debt, and securing Medicare for our citizens.
The gentleman yields back.
Gentleman yields back.
The chair recognizes the gentleman from Ohio for a motion.
Adjourn in the House. I move that the House do now adjourn.
The question is on the motion to adjourn. Those in favor say aye. Those opposed, no. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow morning for our debate.
The House today passed the rules for debate on 3 bills, including 2 offshore oil and gas drilling bills. One deals with drilling along the U.S.-Mexico maritime boundary in the Gulf of Mexico. The other would expand offshore drilling leases. Also this afternoon, the House debated a bill requiring an inspector general to investigate allegations of retaliation against victims who report a sexual assault or misconduct in the military. A final passage vote on that, as well as the 2 offshore drilling bills, expected this week. Watch the House live here on C-SPAN when members return tomorrow at 10 Eastern for speeches and noon Eastern for legislative work.